Hi, I'm Dr. Chris Heimlich. I'm a chiropractor that's focusing my postgraduate studies on functional neurology, and I want to talk to you today about how we can change your life, help you eliminate the problems that you've been having. Over the years, brain-based therapy has treated hundreds of different kinds of balance disorders, and today what we're going to talk to you about is how we can change your life, help you eliminate that problem that you've been having. Let's talk for a few moments about what kinds of different balance disorders there are. Well, there's a whole big laundry list of them, and here's some of the more common ones. First, we have what everybody's heard of, vertigo. So we've got vertigo with spinning. We've got vertigo without spinning. We've got ataxia, which is like a type of clumsiness. We've got disequilibrium, is where your balance is literally off. You're walking down the hallway and bumping into things, and you're just not sure of yourself. You might even have to grab onto a chair for balance. We've got what's called visual vertigo. Visual vertigo is like one of those old Alfred Hitchcock movies. You know, Jimmy Stewart walks into the room and all of a sudden you're overwhelmed. Your brain feels like you're moving. It feels like you're spinning. That's a type of visual vertigo. We've also got a disease called Meniere's disease, which is a disease of the inner ear. And it causes hearing loss. It causes severe nausea, vomiting. And these people just have horrible balance. And then we've got vague complaint of dizziness. A lot of people say dizziness when they just really don't know what it means. They just can't describe it. They just know that they don't feel right. Something's off. Maybe like their vision's a bit blurry, or they move quickly and it seems kind of blurred. It makes them feel bad. There's a whole laundry list, different types of balance disorders, and one of the most common ones is benign paroxysmal positional vertigo, which is a lot of words and letters, but basically means this. You've got some debris in your ear. So when you lay down, you turn over, about 15 seconds, the room just starts to spin. Now, if we talk about vertigo specifically, there's two types, exocentric and egocentric. Egocentric means that you're the center. Feels like the world turned around you. Exocentric means that you're the center, or the center's out there and you're moving around it. Let me give you a couple examples of how this happens. See if it sounds like something you've experienced. You lay down in bed at night and all of a sudden the world starts to spin. Or you get up early and the world starts to spin again. Or maybe you're just sweeping the sidewalk. You turn your head to the side, and suddenly you feel like you're going to fall. Or maybe you actually do fall. I mean, the fear of falling is usually because you may actually fall. Some people will just feel like they're being pushed right over the edge of a sidewalk. Here's another way to remind you of vertigo. You're in traffic, and you're sitting there, and a car next to you kind of rolls backward a few inches. You grab up onto the steering wheel because you feel like you've moved. You get kind of a nauseated feeling. Or here's another type with people they can't read in the car because when they read, they see the telephone poles moving peripheral and it makes them sick. That's a kind of vertigo. So those are some of the more specific descriptions of how you can get vertigo. And now what usually happens with these people, that if you haven't been suffering with these types of things that we've just talked about, here's what normally happens. You go to the doctor, you actually probably go to 3 or 4 different doctors before someone finally gives you an idea of what's happening. And you probably have an MRI, and you may actually have more than one. You might have a couple MRIs, maybe even have a CAT scan. You may possibly even go get some advanced testing where they put some water in your ear. And here's the frustrating part. Most of those tests are normal. There's nothing on them to explain why you're feeling the way you feel. So then some people say, maybe you're just making it up or crazy. People come into me and say, no one's listening to me. I'm telling them something's wrong, they can't find it, so they think I'm making it up. Or they tell me I need to take antidepressants. And that's really frustrating because that leads you to suffer. What's even more frustrating? Even if they do find something abnormal in this test, the treatment that they give you a lot of times doesn't work. And I think that's just sad. Now, one of the things that's very common is they give you a medication called Buckley, which is kind of a sedative for your vestibular system, or your inner ear. And that might work for a little while, but most people it doesn't really work for them. And that's where I come in. Because when all these treatments don't work, when everything's normal on the MRI, they come to see me. Because I got to tell you something. Here's the key to solving balance disorders. Balance disorders are not simply a problem of the inner ear. And that bears repeating. Balance disorders are not simply an inner ear problem. And what gives you normally gives you good balance? What gives you normal balance good balance normally, and good steadiness, is a complex interaction between a couple of different systems. Your visual system, which are your eyes, your muscle and joint feedback system, which is what your body's doing, and your vestibular system, your inner ear. What's your head doing? When all these systems are playing together nicely, and when they're communicating together, each pulling their own weight, they calibrate, things match up, and everything makes sense. You've got good balance, and you've got good steadiness. Now the next area of importance is the cerebellum. And what I'm about to share with you is probably really going to change the way you look at your balance disorders. The two biggest causes that I've seen in my experience with patients for the cause of balance disorders that we just talked about is a problem with the cerebellum or a problem with the cortex of the brain, not just the inner ear. The cerebellum and cortex of the brain do incredibly important things. They're processing stations for all the different sensory input that happens. This is one of the areas that starts to, if it weakens or deactivates or doesn't start to pull its weight, everything gets thrown into chaos. The system doesn't match up. And I'll give you an example. It's like, let's say that you have a balance disorder, and that's because your muscle joint feedback system isn't sending the appropriate signal to the rest of your brain. So here's what happens. The other systems, they turn it up, they crank it up, they ramp it up, and they become hyper, substituting, compensating for what you're missing. Well, the problem is, that's what gives you the dizziness. You're standing there, and someone moves in your peripheral vision, and it starts to feel like you're moving. It's because your system is in conflict. I mean, you've heard of conflict of interest. This is a conflict of information. One area is saying one thing, the other area is saying another thing. They don't match up, and that's why you get the nausea. And if it's bad enough, you can get sweating, you kind of feel like you're going to pass out. Maybe very bad, you get a headache. It's because the system is out of balance, and they're in conflict. So the two single causes, the biggest causes, is a problem with the cerebellum and a problem with the cortex. So how do we find out what's going on and assess that? Well, as you already can tell, how our approach is different than most of the other things that you've had. The very first thing that we're going to do is we're going to do a very thorough exam of you. We're going to look at your cerebellum. We're going to look at your vestibular system. We're going to look at the cortex. We're going to look at your joint feedback system. We're going to triangulate where the problem is so we don't waste your time. Just thinking that's an area of problem. And one of the things we're going to do, we're going to use these two guys right here. I know they look kind of funny, this pair of goggles with a red and white striped tape, but these things can change your life. They give us the keys to eliminate your balance problems. We're going to find out, which one of these areas is working right. We're going to zero in with laser specificity and find out exactly what we need to get rid of. So what are we actually going to do? How are we going to treat this thing? Well, the first thing we can do is what's called a caloric. We can use unilateral adjusting. We can use cerebellar feedback exercises, complex nonlinear movements for cerebellum, saccage, we can use pursuit, smooth pursuit exercises, vestibular rehabilitation, core exercises, and a bunch of other things you've probably never heard of. And the reason we use them is they work. Over the last years, brain-based therapy has helped out many patients with balance disorders, all types, Meniere's disease, everything, ataxia, vertigo, spinning, spinning, without spinning, visual vertigo, blurred vision, you name it. And even lots of things that don't even have a diagnosis. I'm going to tell you something. I don't care what anybody's told you. I don't care what other doctors have told you. I don't care what your diagnosis is, what one you've been given. I want to help you. There is help out there. What you need to do is find someone who understands this information. You need to find someone that understands that balance disorders are not simply an inner ear problem. You got to find someone that can assess your cerebellum, your vestibular system, joint feedback system, all those things. Find out where things have gone wrong. I don't want you to suffer another day. There's no reason for you to be suffering. I want you to go out there, find someone who understands this, and get your life back. So you can start enjoying things you haven't been able to do. I want you to feel good. I mean, feeling good, that's what life's all about.